If you have endometriosis, or if you suspect that you do, the sad truth is that you will probably have to deal with a multitude of doctors who are misinformed and overly confident about their misinformation before you find someone who can actually treat your case. If you're not a fan of having your time wasted and your body damaged by people who aren't actually treating your case, here are 6 questions to ask your gynecologist. Number 1. Do you believe painful periods are normal? If your doctor replies with a, "Yep, that's just how it is," you have a problem, because many women have periods that maybe are a little painful, but that don't in any way stop them from enjoying their life once a month. I know this for a fact because even though I have endo, I was well into my 20s before I had cramps, really any cramps, with my period. And that was only because I was taking the pill. So it was the pill that caused the regular cramps and not my period. So a doctor who thinks that painful periods are normal is misinformed and also probably not a very sympathetic individual. They won't be sympathetic to your pains, and that's something that you need. You need someone who's not going to belittle your suffering. 2. Where does endometriosis come from? If your doctor replies with just one explanation and says that that's the only one, you have a problem, because there are multiple theories for how endometriosis works, and as yet there is no one definitive answer for why endometriosis happens. Number 3. When the doctor prescribes you any kind of pharmaceutical, a pill, a shot, or anything, you should ask them, is this the only option? If your doctor is like, yep, chemicals are the only way to go, you might, again, have a problem, because for the most part, you can treat your endo or symptoms of your endometriosis by doing a lot of different things. For example, I gave up gluten, and that helps keep down inflammation generally in my body. When I first told my doctor this, they didn't have a great response to it, but then a few months later, their partner had given up gluten and was seeing changes, and so now that the doctor was seeing this in a more intimate sense, they got it. They got that giving up gluten could be something that actually is useful to people. So a doctor that has that kind of more open-minded way of looking at things, it's not all about selling you pills, that's really important when it comes to endometriosis. Number 4. Why does X happen, and how is it related to my endometriosis? When I am saying X, I mean some kind of a symptom that is not generally associated with endometriosis, but that you're pretty sure has to do with the disease in your case. If the doctor just tells you to go see a specialist, or just dismisses you, or says something like, sometimes endometriosis pain just happens, which is what one doctor actually said to me, you have a problem again. Doctors who treat endometriosis need to be really imaginative, need to be trying new things, need to be working with their patients. So if they're not listening to you about this particular symptom, you really might have a problem. Number 5 is a question only for a gynecologist who's going to do the surgery on you. Lots of doctors can help you treat your endometriosis on a daily basis, but very few doctors can actually perform the surgery for your endometriosis, even though more doctors think they can. So the 2 questions to ask of the doctor who's going to do the surgery is, 1, can you do a laparoscopic surgery? And 2, do you do excision? The first question is about the facilities and the training that the doctor has. So a laparoscopic surgery is a surgery that uses a machine that only cuts small holes into your body, which makes it easier for your body to recover from the surgery. And so the doctor has to have access to that machine and has to know how to use it. And then the question about excision is about the generally now accepted way of looking at things, which is that cutting the diseased areas out from the root is what needs to happen. Before, doctors were just sort of cutting off the surface of the endometriosis, or they were burning it, and that is really not effective. So excision is, your doctor just needs to understand excision, otherwise you have a problem. Number 6, do you believe a hysterectomy is a good option for someone suffering from endometriosis? If your doctor says yes, you have a problem. Hysterectomy may be an option in some cases, but that doesn't mean it's ever a good option. So if the doctor doesn't immediately have a reaction of like, whoa, let's look at all of the options really carefully, have you tried everything else, you have a problem. Also, and this is purely anecdotal evidence, of all the women I've known who have had hysterectomies to treat their endometriosis, and there have been a handful, none of them has had a success in the sense that for every single woman, the pain has come back after a certain amount of time, after a few years. So giving up a body part in exchange for a few years of relief, maybe it's worthwhile, but then you don't have a uterus, and I'm pretty sure it was put there for a reason. Doctors occupy a privileged place in our society. Many of us trust them immediately because the alternative, not being able to trust your doctor, is really scary. Also, when someone doesn't trust doctors, people kind of think of them as backwards, and most of us don't want to be seen as backwards. Still, the fact is that trust must be earned. If a doctor doesn't listen to you and to your assessment of your body, that doctor is definitely useless and possibly dangerous to you. Especially when it comes to a disease like endometriosis, which is so little understood.